First up at 11 on this Friday and live on the Channel 3 streaming news app, we end the week right now with new information just coming in on the coronavirus here in Connecticut. And we start tonight. Just under 24,000 people here in our state have now tested positive for COVID-19. And the issue that dominated today's news conference with Governor Lamont involved nursing homes. The death toll in Hartford County is starting to dramatically rise, in part because of those deaths in local nursing homes. Today, we learned 43% of the total deaths in our state are connected to these facilities. Channel 3 Eyewitness News reporter Matthew Campbell is live right now with more on what's being done for the residents and the workers. Matthew?
Well, Mark, the governor admitted we are seeing flare-ups inside nursing homes, and we do have the numbers now. New at 11 tonight, 568 confirmed, another 200 probable. This is something we have been addressing for weeks now, and the cries are only getting louder.
The reality is grim inside Connecticut nursing homes. With 43% of the total deaths in our state connected to these homes, the most vulnerable population is being hit the hardest, and those working inside the homes are also getting infected.
The administrator is not able to provide us with the equipment that we need.
Images of two nursing home workers wearing plastic garbage bags because of a lack of protective gear emerged today.
It's completely unacceptable in a healthcare environment, so those are obviously investigated when we hear about them. We don't have any evidence this is a widespread practice.
Governor Lamont says the global search for the proper gear continues, and FEMA will start delivering masks and gowns at the beginning of May. He also mentions nursing homes are private and can try to secure the gear on their own.
The unions, they look out for the public health and welfare of their workers. They can go out and get the gear and look out for their people as well. In the meantime, I'm going to take this on my shoulders and do everything I can to keep these people safe.
But for those on the front lines, they're finding this scary workplace reality is seeping into their homes.
It's scary. When you watch your 12-year-old ask the emergency room doctor how many kids died from it. That's something you never want and never can imagine.
The Department of Health is now investigating, and the governor says visits to each of the 215 nursing homes in the state will happen.
My goal is to have every single nursing home with a physical inspection so we can talk to people and find out exactly what's going on.
We learned in some cases, possibly because of the risk of infection, visits are happening via FaceTime.
Walk them from where the patients are to the room where the PPE is stored while keeping the video running. So you can actually, through a video, FaceTime session, you can actually accomplish a good amount.
Now, if you or a loved one are in a nursing home, or if you know someone who is in one, working in one, that death toll is a huge cause for concern. Right now on the Channel 3 app, you can go home by home and see these numbers for yourself. For now, live above the newsroom, Matthew Campbell, Channel 3 News.
Matthew, it's so upsetting to so many people. Two quick questions, though. First of all, what will they be looking for when they go to all of these nursing homes, and are there actually any consequences?
Yeah, Mark, they're going to be looking at the conditions. They want to see if there's enough protective gear. They want to see if the residents with the virus are being properly separated from those who don't. DPH can issue fines or even revoke the license of the home if there are violations, but so far it has not come to that point.